So, Dr. Webley, you know, oftentimes communities of color are pretty skeptical about vaccinations and things of that nature. And so what would be your response to, to communities of color who are, very skeptical of this vaccination in particular?
Yeah, thank you, Jeff. My response would be, take your time to understand what this is about. The African American community has reasons to be skeptical of medications and government programs. Looking back at studies like the Tuskegee syphilis study, where African American men were treated really badly, leaves a bad taste in all of our mouths. And it puts us in a position where we're always looking to see, is there something else going on behind these good things that we are being presented with? However, as a scientist, I'm a microbiologist, an immunologist, someone who studies vaccines for a living. I would say that these vaccines that we have for COVID-19 are safe and they work very well. I have read through all of the material, I've looked at all the studies, and yes, this is a medication. So you have to be thoughtful about taking any medicine. But I've looked at the side effects and they're no different from the side effects that you get from the measles or any other types of vaccine. The platform for these vaccines is new as a vaccine platform. However, they've been in development for years. And the studies have been done and have been evaluated by scientists who mean well. And they are open for the entire world to see them. And as a result of that, we can look and see that these are safe vaccines for everybody. In fact, these studies had just under 10% African Americans in them. And so the vaccines were tested on African Americans who volunteered to be a part of these studies. So my advice is, take the information that you get from social media, from people just sending it around on WhatsApp, and evaluate it. Ask questions, look at credible sources, and don't allow anybody to tell you that your fear is unwarranted. There's a reason for that fear. But at the same time, if you don't get this vaccine to protect you, we know that African Americans are dying at a disproportionate rate from COVID-19. So that also is a problem on the other side.